be very important, and I do not want you to miss any of the points here. Hey, if you're new to this channel, I am Teena. I'm a health psychologist. I'm a mom of a preterm baby who was born at 30 weeks with 1.27 kgs of weight. And now my daughter Olive is an adorable toddler who is very naughty. She is 2 years old and 11 kgs of weight. In this video, I'm going to discuss about the signs of emergency. You need to look at your baby, observe your baby, and if you find any of these points in this video, it's high time that you take your baby to the doctor. Please make sure that you watch this video until the end so that you don't miss any of the point, because all these points are very important to keep your baby very safe. I have also mentioned this topic in my book over here. It's a complete guide for preterm baby care at home. Right? So without further ado, let's get straight into this video. So the first point is if the baby turns blue or purple. This indicates the lack of oxygen supply to the baby. It's a high emergency. You need to rush to the hospital immediately if you find your baby turning blue or purple. Do not try any home remedies at this point of time because the baby needs oxygen supply and high medical intervention. The second point is when the baby is unresponsive. Even if you try to wake the baby up, the baby is not moving, the baby is not responding, the baby is feeling very lethargic. But don't misunderstand with the deep sleep, because you know that happened to me once. When we got Olive from the hospital into our room, from NICU into our room, into our special care room, at that time I fed Olive and she was sleeping, and they told us to feed us every 2 hours. So I was trying to wake her up to feed her after 2 hours, but she was just not waking up. So I was so panicked. I called the nurse and she came down and she told that she was just sleeping. She was in deep sleep. But here there's a difference. When the baby is sleeping deeply, you can see that the breath is in a pattern, in a state of pattern. The breath is proper and normal, and the baby also has certain slight movements like, blinking of eye or anything when you touch the baby or anything like that, even if the baby is deep in sleep. But when your baby is literally not responding to anything, you wake the baby, you move the baby, you touch the baby, you speak to the baby. If the baby is not responding, it's a high emergency that you take your baby to the hospital. But just because I told you about this, don't be obsessed in waking up your baby all the time and disturbing the baby. Do not disturb the baby when the baby is deep in sleep. Just try to observe them. The third point is when the baby's body starts getting cold. Even if the baby is fully clothed, you have mittens and kittens and sweaters, the room temperature is warm, the clothes are there, blankets are there, everything is there, but still, if your baby is getting cold, it's high time that you need to consult your doctor immediately. The next important sign of emergency is aspiration. This happens when the baby's milk comes back to their mouth or sometimes goes into their lungs. If some fluid enters a baby's lungs, that situation is called aspiration. It completely blocks the baby from having normal breathing condition. This is especially dangerous if you lie your baby down soon after giving feed, which I always tell not to do. And it also happens if you feed your baby in sleeping positions. Mothers, I encourage always to put height, elevate your baby and then feed. Do not sleep and feed your baby. Be attentive when you're feeding, whether the milk is going in the mouth or in the nostril, or if the baby is able to swallow it properly or not. Even when you're asleep, just put the baby in an elevated position. The best way to feed your baby is always in sitting position, even in the middle of the night. I have personally seen many babies die, unfortunately, because of a little negligence from our side. The baby cannot swallow something that is in their throat, so that will just pass through sometimes in their lungs, because the distance between the stomach and the lungs is very small in preterm babies. So this is the reason, never lay your preterm baby flat on the bed. Always have an elevation of 45 degrees. I have given many more details in my book, Mommy, I'm Here But a Little Early, a complete guide for preterm baby care. In this, I have detailedly discussed about this topic and all the tips that you need to take. It's available on Amazon, Flipkart, and OceanPress. Do not lay the baby down flat on the bed or on the floor or any surface soon after feeding. Burp your baby at least for 45 minutes for preterm babies. This I'm telling you very, I'm stressing the point. Be very careful and attentive. When Olive was like around the first 3 months, we never laid her down until we used to give kangaroo mother care continuously for 20 hours throughout the day. And especially after feeding, I just used to burp for 45 minutes. Sometimes the babies take a lot of time to burp. Just lay down the baby after burping, that too at 45 degrees of angle. I know I'm repeating myself again and again and again. Just understand how important it is, because I have seen literally babies losing their life because of a little negligence from our side. The next very obvious sign of emergency is choking. This choking hazard is there for babies until 5 years or even 6 years or even for adults sometimes, but it is more when the baby is very little, especially in the first 2 years, because the babies learn a lot, they try to explore things around them, so they keep on putting everything in their mouths, and sometimes accidentally it just they swallow it and it just stucks in the throat. They will not be able to either swallow or spit it out. It will be there obstructing the airway and they cannot breathe. I'm literally telling you, they have very little time to survive, so you need to be hurry. You need to take the baby immediately to the hospital, to the nearest hospital. Don't be obsessed only in going to your pediatrician. First, take them to any of the hospital nearby, get the thing out and the air flow running smoothly. So choking is very dangerous. Keep away anything small, anything that passes through your baby's throat. You think of that size, you please avoid. Coins, buttons, safety pins, or any small things, and sometimes Legos. We don't know, they may keep anything, especially nuts, peanuts and peas or anything. So just be careful. I have made a detailed video on choking hazards for your baby. You can watch this video to avoid the things that are really hazardous for your baby and that cause choking. The next point is very rare. That is sudden drop in feeding. If your baby is, for example, drinking around 150 ml of milk per day and suddenly the baby is drinking only 20 ml or 10 ml, there is a sudden graph decrease. So there's a decline in the milk intake of the baby. That is a significant, important sign of emergency, that something is really wrong with your baby's body. The baby is not feeling well inside. That's the reason the baby is not drinking the milk. So it's high time that you need to take the baby to your doctor. This point can sometimes confuse you. Fast breathing is a sign of emergency, but fast breathing only when the baby is in resting position and the baby is completely calm. Always observe the baby, if the baby is breathing normally or not. When the baby is completely in lying position, in rest position, and the baby is not active, the baby is not playing. When you see the baby breathing fast when the baby is lying down and calm, then that is a sign of emergency. Usually babies have fast breathing when they are drinking, when they are feeding, or when they are playing. So while drinking milk and while playing, they usually breathe fast, and that is completely normal. There is no problem. But if the baby is just sleeping and the baby is not doing much things, but you can see that the chest is indrawing, the chest is going inside, it's like pushing inside and the baby is then that shows that the baby is really in high risk and you need to immediately rush to the hospital without wasting time. So that's it for this video. I hope you all learned something out of it, and do remember these points when you're taking care of your baby, especially in the first 6 months, I could say precisely the first 3 months. But do not worry, do not panic. This doesn't happen to all the babies, to every baby. Just take care of your baby as much as possible. Trust God, believe in yourself, trust your baby in all this. You have wonderful memories with your baby. Don't just be so afraid that you forget to enjoy every moment with your baby. Enjoy motherhood, enjoy parenting, enjoy the cute little preterms that you have, because trust me, you will never get this time. You will never get these memories back. So be prepared, have the knowledge, but enjoy the moments as well. I'll see you all in the next video. Until then, take care of yourselves and take care of your little ones. Bye-bye.